Jai Hind, Hare Krishna researchers. In the first part, we discussed about the introduction of a research thesis or a protocol. This we are going to discuss about the next part. The most important thing in a research protocol or a research thesis is literature review. When we discussed introduction, what to write, what not to write, and all those things we discussed. But in terms of literature research or literature review, we'll have to accept and understand one thing. That is, it is not primarily done to present the research, right? It is primarily done, a literature search or a review is primarily done to understand the basics of the particular topic, what research has happened in the past, the history of that particular area has to be understood and analyzed. See, the very reason why we call it a research is that we are again and again searching, right? So there is nothing complete with one topic, or it's not going to end over there. It's all dynamic. It keeps moving. Like so, a various number of researchers are done on a particular topic, and it's not going to stop with one researcher that it is the final outcome. There is always a room for improvement, or there is always a, they say that change is the only constant, so things can keep changing, so it's dynamic. And with this, we have understood one point in the first 1 minute, that literature review or literature search is not for presenting it to someone else, but basically it is done for the researcher's own understanding of what has happened in the area in the past, and what is my research question, how are these related, what have they done, what is their outcome, and still what is the gap, and from there how am I going to take this research ahead to the next level. This is what is the understanding of literature review or literature search. It is not for just presenting, it is for the researcher's own understanding of what has happened in the past. You can build only when you know what has happened in the past, and when your research question is still valuable, then you will be able to build your research question, or answers for your research question can be found out based on what has happened in the past. So the past becomes very important, and how did they do that research, that is also very important. Like, what was their aim, what is their methodology, how did they arrive at a particular result, and all those things. Now, typically, what happens with a literature review or literature survey is a researcher, when he embarks for research, he literally searches via Google, goes to the authorized platforms, or goes to the indexed journals, and finds out what are the various articles published, what are the various research that has happened in the past, and all those things. But let us not forget, even in the drug information resources, we study about primary, secondary, tertiary resources, right? So here also, for your research in the literature review, a physician's desk reference or a protocol for a therapy which has already been established, or things that has become a part of the routine in the past, can also be a review of the literature. Not just only the recent study that has been published in a journal has to be considered as a literature review. So that has to be understood, and then we will have to move ahead. What's the most important point is we have to do a relevant literature review of the literature, because when you go beating around the bush talking about something general than what your research question is, it's of no use. So you have to be very specific about your literature review, what has happened in the same area as that of your research question is what is very important, right? So what are the strengths and weaknesses of the past studies that has happened has also to be analyzed in the literature review. Not that that study has happened and it has come out, no. Was it statistically significant, what statistical methods have been used over there, what is the outcome, in how many, what was the sample size, and what is the percentage of prevalence or incidence of the particular disease. Is that significant enough when it comes to statistical outcomes. All these things, the aim, the methodology, the setting in which they have done, the site of the study, the instruments they have used to find out the outcomes, or to take the messages or the data from the patients, or whatsoever it is, right? If the literature review is not going to be relevant, then the reader would get frustrated. Please understand that you will also not get the right information to build your research questions basics if the literature review is not going to be relevant with your particular topic. So please ensure that you are going to be focused, you are going to be relevant when you do the literature review, because if you are not relevant, if you are not focused on your research question and what has happened in the past with that area, you will be distracting yourselves, frustrating yourselves, and also the readers in the future. Even for the protocol, you will be frustrating the reader. So when the protocol has to be approved by the ethics committee or the research committee or the review board, you will have to understand that the literature review has to be very specific, it has to be very relevant. Now many people say there are many kinds of literature reviews and all those things, but I believe that it should be based on common sense and presence of mind. But even then we can say that there is a general literature review. See, without mentioning this has happened, a particular significant step has happened in the area of your research, if there are many other researchers, you can include them in the introduction part 1, because introduction is also a setting of the scene is what is going to happen, like you are going to set the theme there. So there also the past research matters, so you can use those kind of literature reviews in the introduction. But when it comes to literature review, you have to be very specific on the steps of development in your area of research for your research question. So it has to be completely customized for what you do, right? So you should not use a general literature review style in the literature review part. It can be used in the introduction part of it, right? This author, this study has happened like this, so that is what is the statistics there, and they have done like this. This can be a part of the introduction, but in the literature review part, it should not be there. Now, the other ways like theoretical literature review, methodological literature review, historical literature review, we can classify by giving, fancy names to all those things. But please understand that we are going to see the history. We are going to review every study. We are going to talk about the methodology, the aims and objectives, the sample size, and the statistical impact and the outcome of every study. That's what will be interesting to us for our research question. Now, if you intend to do a good literature review, you have to know the clear cut gap present in the knowledge area today. Number one, what are the unresolved questions or unresolved debates that are happening currently in that area because of which you have started your research question? What are the inconsistencies in the area? What are the new questions, and what could be the relevance? Like, your research question and has to address a particular gap, right? So towards that gap, what are the literatures that are supporting you? Like those studies also have questioned the same gap, but no further research has happened over there. Many research studies have come to a point that there is an unresolved debate which has to be answered, and that is my question, that is my research question, that's what I'm going to do my thesis as. That's what my project is, like that. Inconsistencies in those studies which has happened in the past is my point, where I'm trying to say that I'm going to do that research and create or bring in a consistency which is not available in the past studies. So like that, it has to be relevant, it has to you know lead to newer questions. The inconsistencies of the past studies or the areas which are not resolved yet, and the gap that is present in the present knowledge. So all these things will have to be highlighted if you want to do a good review. And to avoid a bad review, as I said earlier, please be focused, please be relevant, don't distract and frustrate the reader. You should also, you are the first reader, right? You are doing the research, so you should also not get distracted and frustrated by reading something which is not focused to the point and which is around the bush. Now, so now, literature review. What all literature review offers? The literature review, when the researcher goes and does a complete literature review from the textbooks, the primary resources, from the journals, publications, and all the other things, what he gets is he or she gets a historical background of his research. That's the basic idea of literature review. What has happened historically in the area of my research in with respect to my specific question is what is the first thing that they get. Number one, because it talks about 50, 60 years, 100 years, before 100 years something has happened, nothing has happened in the last 100 years, before that it has happened, then it stopped, but it's a pertinent question today. So like that, there are many things that could have happened before, which are interesting, which are a step ahead, like than their earlier research, and so they are value additions to you. So it has come up to this level, and now it has to be taken to the next level, and that's why I am planning my research. So that's what is the understanding. So the literature review should give you a historical background for your research. That's step number one. Number two, now only history is enough? No. In the past 5 years and current, today and yesterday, what has happened in the area of my research question? That is also important. So, past and present both are important. So, one point is history, second is where are we standing today? Right? So, I wanted to go to a particular place. I started from a particular place. I came through all this. Now I am standing here. Now what is happening in this place? How can I go to the next place? So that is what it's a very simple common sense presence of mind based thing to do. Now, what are the relevant theories and concepts that are already established, that are unanswered already? So these things are also important. Basically it is history as well as present, right? So now your research question is going to be the future. So past, present, and future. So all the three things have to be taken care of. If your research is not futuristic, if your research is not having any novelty, if your research of the topic is not going to add value to the patients, if your research question is not going to add value to the existing knowledge gap, if it cannot answer a question which is already prevailing, if it cannot solve a confusion, if it do not have any one of this, better that question is not fit for a research. And when you do a research, you will have to publish it. And when it is not published, it is as good as not doing a research. So this has to be understood. Now, all this literature review, we can do it from, we know journal articles, but we have to accept that, the primary resources like books are also can be reviewed in the literature review. Other dissertation and thesis, other established theories, other books and references that are available, you can take all this past history or the current developments from any of these areas, and you can do it. Now, how are you going to present your literature review in the protocol or in the thesis? It depends on the style in which you have done your literature review. Now, some people do it based on years, like the latest research that has happened is listed first, chronological order, they say. So 2022 comes first, 21, 20, 2019, 2018, 2017, like that. Some researchers where there is a daily development, we don't go beyond 5 years of past or 5 years of history, because there are daily developments and we need to focus more on the present from where we have to grow, right? So certain researchers are there where there will be a huge gap. There will be no work between 2015 and 2020. So there we have to go beyond 2015 also. But whenever there is a research where there is a daily development, we go to maximum 5 years of the past background or history. And from that, we collect all the materials. How have they done their research? We do the methodology, a critical analysis, methodology, aim, objective, statistical importance, results, and how pertinent is that outcome to my research question. Is it supporting my hypothesis that I have to do this research or not, is the question, right? So it is a chronological thing. Certain places they may always use the other way also, chronological in the ascending order, not in the descending order. Like I spoke about 2022, 21, 20, 19, 18. Now they would be taking it like 1990, 95, 98, 2000, 2004, 2005. That way also is possible. See, the idea is when we are talking about research, we are again talking about what is the present and from where we have to go ahead. So that's what is the understanding. There are many methods of presenting it. One is the chronological order. The latest first is always better because it gives a clarity of information. there is something like a categorical list of literatures that can be presented. Like, suppose my study has got two or three arms, so I present those arms in separate categories. Like, the literatures on the question about a particular disease is this. What am I going to do in the particular disease is this. So if you have different categories of studies, like, that can be presented. Or if you have categories of studies, like, I have two meta-analysis studies, two systematic reviews, and one or two clinical trials, like randomized control trials, and 10 or case control studies, and one is a case series. So in those headings also you can categorize. The idea is not that you have to go strictly by this. The idea is to present, to understand for the researcher himself, and to present to the people who are going to read the thesis, or read the protocol for giving an approval before the thesis is started, to make them have clarity that what all has happened in the past in the same area where my research question is also there. Now, that is the idea. So, one is chronological order, one is categorical order. The second, maybe the third, maybe the a summary of what has happened in the past can be just compared or just described, with a summary that this has happened in the past, like that. A summary can also be done. But the most preferred is the chronological order with a critical appraisal. Critical appraisal of compare, contrast, analyze the strengths and weaknesses of the study that has happened, and what has happened in the past. All those things can be compared and contrasted for the strengths and weaknesses of the studies that we have compared. So one is chronological order, second is categorical order, giving a summary is the third one, and fourth is a critical appraisal. But whatever you do, there should be a critical appraisal. Even if you present the studies in chronological order, there should be a critical appraisal of the particular literature that we are reviewing. That is very important. Above all this, once we are doing all this research, this, that, we have to know that the references have to be done, the references have to be maintained properly, the references have to be mentioned properly. There are two, three styles that they talk about, major or the Vancouver and the Harvard style of referencing, which most of the journals accept. So these two things you have to find out what it is. We will see in the future videos on what is Vancouver and what is Harvard style of referencing, all those things. Once we go towards the end of writing the research thesis, this is just part two. We are in the introduction and the literature review now. So now, most important thing is most of us. What do we do in the initial stages of research when we do the first project or something? We copy paste from certain studies, certain journals, from the books or other things, which should not happen. No sentence should be copied from any of these things. Then that is not considered a original work. That's why they say original research article in journals. They say every article should be original. That is what is the understanding. It should not be a copy paste of any of these works. Now they are talking about softwares, plagiarism, and all those things. I do not want to talk about softwares, plagiarism, and all those things, because a literature review or a thesis should be always written by us. The most important thing in writing the literature review is, many of us copy paste the abstract of the study and say that this is the literature review. We put the date, we put the author's name, we put many things, and we say that this is literature review, copy pasting the abstract, which should not happen. We have to study, understand, and rewrite the entire thing in a short summary after doing a critical appraisal. So what happens is, out of all the four types of literature review we saw, like the chronological, the categorical, the critical appraisal, and the summary, we have to follow all the four in one, literally, right? We have to present it in chronological order. We can categorize the studies on what kind of study they are. We have to do a critical appraisal, and we have to do the summary by ourselves and write. We should not copy paste it from any of the studies that are published or that are already available. Not even the abstract should be copied and pasted. Aim, objectives, methodology, conclusions, the abstract can be pasted just like that as it is. It should not happen like that. So don't copy paste. You have to read, understand the entire study which has happened in the past, or the theory in the textbook. Because it is not only, again I am saying, it is not only the journal published articles, it is also textbooks which can be a part of the literature review. It can be other thesis, whether it is not published or not published, we can take those theses also as references here. So you have to read, understand, write notes, and you have to get the correct understanding and then rewrite it and present it. Now, while doing so, you have to organize it in a flow based on the types that we discussed. It can be organized based on the category, or it can be organized based on the chronological order. The way you are going to present one after the other, the literature review has to be presented like that. Now, before sending anything to anyone, let it be a thesis, let it be a protocol, often what happens is the language mistakes, the spelling mistakes, the grammar, the typographical errors create a lot of irritation and distraction to the reader, especially when they are busy and they don't have time to, do all these things. When simple things cannot be done properly, how can you do great things? That is what is the understanding, right? So, edit, revise, do a spell check, do a grammar check completely, and then think of adding this literature review part to the main thesis or to the protocol, right? So now, what does this literature review mean to the reader? Now, we said it gives information to me about what has happened in the past, about what has happened in the present. It gives information to the reader about the history. The reader need not again go and check with all the resources, primary, secondary, multiple levels, and he has to check and understand, what has happened through multiple resources in this particular area. Like, when we talk about introduction of a research, when you do an introduction of a research, you can use the general literature review, for which from which you can write the introduction. But in the literature review part, it has to be specific studies pertaining to our research area. Now, as introduction sets the stage for the particular topic, for the particular research area, literature review decorates the entire stage with existing knowledge. Literature review decorates the entire stage with existing knowledge, maybe past as well as the up to date knowledge. So, what happens is, to the writer of the literature review, the literature review offers him expertise on the topic because he or she has to do the research. So, you get the expertise, and the reader gets a glimpse of what has happened in the past and what has happened in the present, from where you are going to address your question. So it will put off most of the questions by a reviewer, researcher, or a ethics committee, that why you want to do the research and what is the basis of this research, what has happened in the past, and from where you want to start, how are you planning to go ahead. So all these questions will be answered in literature review for your own self, as well as for the reviewer, ethics committee, when they review the protocol, and when the thesis is presented. This will give idea to the reader on what has happened in the past, without he or she going himself or herself to find out from various resources from where are you starting and how important is this research. Thank you. Jai Hind.